Hey guys, welcome to Wonder Science. My name is Pratik and I'm in 8th grade. And on this channel, we are going to be learning and exploring new things that you and I might not have known. Today, we're going to be learning about the common cold. It's nothing too scary, everyone gets it, and it's not very harmful either. The overview. The common cold is a viral infection of your nose and throat. It is mostly harmless, but you might not feel that way. Many different types of viruses can cause a common cold. Healthy adults can expect to have 2 to 3 colds each year, but infants and young children can expect to have more frequent colds. Most people recover from a cold in a week to 10 days. However, symptoms might last longer in people who smoke and have a weaker immune system. You don't generally need medical attention for the common cold. However, if your symptoms don't improve or get worse, you should consider seeing a doctor. Causes. A cold is caused by any one of the more than 200 different viruses that cause inflammation of the membranes that line the nose and throat. But the rhinoviruses cause the most colds. The common cold is easily spread to others. It is often spread through floating droplets in the air that are coughed and sneezed by a sick person. The droplets can then be inhaled by another person. Colds can also be transferred when a sick person contacts you or a surface that you then touch, such as a doorknob or a countertop. Some more causes. Opposite to the popular belief, a cold is not caused by cold weather or being chilled. However, more colds occur during the winter months, early fall to late winter. This could be because schools are in session, which increase the spread of the infection. People are spending more time indoors and are in closer proximity to each other, and there is a low humidity which causes dry nasal passages, which are more vulnerable to cold viruses. Prevention tips. 1. Wash your hands thoroughly with soap and water for at least 20 seconds. Wash your hands before you eat or after you step away from your house. It is always important to sanitize your hands wherever you go. 2. Clean and sanitize highly touched surfaces, for example, kitchen and bathroom countertops, light switches, electronics including phone, iPad, computer, and doorknobs every day when you get the chance. Eating good healthy food like fruits and vegetables can help prevent a cold. Also, getting good exercise and sleep is really important. Avoid staying near anyone who has a cold. Stay out of large crowds when possible and avoid touching your eyes, nose, and mouth. Sneeze and cough into tissues. Throw away the used tissue immediately after you are done using it and wash your hands real nicely. If you don't have any tissues near you, sneeze and cough into your elbow and wash your hands after. Symptoms in adults. Sore throat, congestion, stuffy nose, slight body aches or mild headaches, coughing, feeling unwell, sneezing, slight fever, headache, and runny nose. Symptoms in children. The symptoms that children experience will mostly be the same as in adults, but children also have a higher chance of experiencing symptoms such as decreased or no appetite, diarrhea, vomiting, trouble sleeping, and fuzziness. Medications to relieve cold symptoms. For fever and pain, you can use Tylenol, is commonly used. Advil or naproxen are two more medications that can also help with the pain and fever. Sore throat and coughing. Throat lozenges such as Cepacol or gargling with warm salt water several times a day may help. Analgesics such as Tylenol and Advil can also provide relief. Throat lozenges contain menthol, which provides you with a cooling and relaxing sensation when inhaled or eaten. This is because of its ability to chemically activate cold-sensitive receptors in the skin. Some more medications to relieve cold symptoms. For stuffy nose, you can use oral decongestants such as Sudafed, and Sudafed can help relieve nasal congestion. For trouble sleeping, NyQuil is a good medication to help. NyQuil includes a number of active chemicals, including acetaminophen and doxylamine. The major component that causes drowsiness is doxylamine. What happens in the body? First, the invasion. If the virus manages to get past the body's external defenses, such as nasal hairs and mucus, it ends up in the respiratory tract. Ends up in the respiratory tract, which is the passage created by the mouth, nose, throat, and lungs. The virus then attaches to the surface of the cells. It will proceed to embed and plant its own genes into the cell after it has successfully connected to it. The virus's DNA takes components of the cell to reproduce new virus particles that are designed for invading additional cells. The breakout. The virus is still trapped during the replication phase. It'll begin the process of breaking out after it has fully taken over the cell. When the copies of the virus are sent into the bloodstream, it leaves behind destroyed, damaged cells. The defense. As the virus enters the circulation, you will begin to notice the initial symptoms, such as runny nose and sore throat, as your immune system sends antibodies to fight the illness. It may take some time for your immune system to gain an advantage in the battle, but if you've had a vaccination, like the cold vaccination, your body would be able to build immune defenses much faster. If sufficient antibodies do not arrive in time, the virus will continue to duplicate and invade new cells. The immune system responds by mobilizing cytokines, which are inflammatory proteins. Consider them to be generals in charge of your immune system, commanding the troops. Cytokines alter the fine branching blood vessels nearby, allowing circulating white blood cells easy access to the infection site. The battlefield. The battle is raging at this point, and you're starting to notice additional symptoms. This is what the various symptoms mean. A runny nose happens as your body creates more mucus to remove the invaders. A sore throat indicates inflamed mucous membranes caused by your immune system sending a large amount of blood that way, so that the white blood cells and antibodies can easily be taken to the infected area. When you sneeze or cough, your body is removing bacteria and other particles with a quick involuntary blast of air. Chills and fever are the body's way of defending itself against the infection by raising its temperature. Body aches indicate that your body is releasing substances that aid white blood cells fight the illness. Second invasion. Following a viral infection, a bacteria infection may occur. The first invasion damaged the cells that are lining the respiratory tract, making it easier for the bacteria to grab onto the airways. Since the immune system is still focused on the primary infection, the bacteria have a chance to settle in the warm, moist environment of the respiratory tract and multiply. Secondary symptoms such as sinuses, pharyngitis, and persistent cough or an ear infection may occur, for which you might need antibiotic treatment. The battle is won. There are hundreds of different viruses that cause the common cold, but your immune system has become resistant to the one you just recently fought. As a result, if the virus ever re-enters your body, your immune system will recognize and defeat it much faster before it has a chance to grow. People, on the other hand, get recurring colds when they come in contact with a strain that their bodies haven't encountered yet. An ear infection or an infection may clear up on its own in about 7 to 10 days, and in some cases you may not even need to file a claim with your medical aid for cold and flu-related symptoms. You could speed up your recovery process by getting adequate rest, drinking enough water, and taking over-the-counter relievers. However, if the symptoms do not improve or worsen after 2 weeks, you should consult a doctor. So, cold versus flu. Many people can get confused between a cold and a flu. Here are a few symptoms that can help you decipher which is which. Cold symptoms: low or no fever, Flu symptoms, high fever. Cold symptoms, mild hacking cough. Flu symptoms, cough often becomes severe. Cold symptoms, stuffy/runny nose. Flu symptoms, clear nose. Cold symptoms, sometimes a headache. Flu symptoms, a headache is very common. Cold symptoms include sneezing. Flu symptoms include sometimes sneezing. Cold symptoms have mild fatigue, people who have cold symptoms may have mild fatigue and slight aches and pains. Flu symptoms, several weeks of fatigue and often aches and pains. Cold symptoms, normal energy level or may feel sluggish. Flu symptoms, extreme exhaustion. Cold symptoms, sore throat, and flu symptoms, sometimes a sore throat. And these are my sources for all the information. You can just take a look at that. And I hope you enjoyed and learned something new. I certainly learned some new things. I hope you did too. And if you have something that you learned new, write it down in the comments. I'll be looking at those. And please like and subscribe. And I hope you learned and enjoyed the video. Bye, guys.